Osteopaths diagnose and treat many mechanical problems in the body. We primarily address the musculoskeletal system, for example spines, shoulders, hips, but we also treat functional problems. For example, people who have asthma have difficulties with their breathing mechanics, so one of the things we can help there is with breathing techniques. So we look at function, how the bodies function, and we're always concerned with improving function in the body. For example, I've got a spine here, so someone might come in with a degenerative problem, and it might be an older person where, see that little gap there? So in an older spine, bone often thickens and it remodels with the aging process, and that can cause an impingement on the nerves. Well, osteopathy certainly can't change that, but we can improve the function of the spine, and that sometimes is enough to alleviate some of the symptoms. In a young spine that spends a lot of time sitting at a desk, problems are often associated with a chronic build-up of muscular tightness. So we try to improve the function in a spine like that by reducing muscle tightness, getting more mobility in the spine, and so forth. Quite a lot of patients come in with shoulder problems, and one of the things that I like to do with all my patients is explain why they've got their problem and explain what they need to do to help themselves get better alongside the treatment. So understanding why you've got a shoulder problem is intrinsic. Now, see that little gap there? That causes a lot of problems for a lot of people. So this is part of a shoulder girdle, and there's a little gap there above the shoulder joint itself where a number of tendons run out and anchor on the arm. Now, for a lot of us these days, working long hours and doing the shopping and looking after kids and so forth, the muscles of the shoulder girdle get very, very tight, and this can cause an impingement of the tendons here. So when we're taking a history and diagnosing our patients, we're trying to find out exactly why they've got that set of symptoms, what's wrong with them. And in understanding why they've got a problem, in this case if it were a shoulder problem, we can then set about addressing exactly that area. So we do like to explain to our patients why they've got a set of symptoms. In this case it would be a shoulder problem, and explaining why a shoulder gets an impingement problem or why there's a restriction in the capsule of the shoulder really does help a patient take on board all the advice we give about what you need to do differently to prevent the injury becoming recurrent or chronic.